Okay, good day, my dear students. I want to give you a lecture about obstetrics, and our first lecture is Introduction in Obstetrics and Methods of Examination in Obstetrics. You can see it's a starting of human being's life. And what does it mean, obstetrics? Obstetrics, it means the birth assistant, somebody who stay nearby the woman in delivery and pregnancy and in postpartum period. And generally, it's a field of clinical medicine dealing with psychological, physiological, and pathological process in the body of a woman related to conception, pregnancy, labor, and postpartum period. Usually we can develop care, prevention, and treatment of pregnancy and labor complication, diseases of the fetus and newborn. What does it mean, perinatal health? It's a system of a medical care for women, fetus, and newborn, including pregravidal period. It means period before pregnancy, labor, delivery, and postnatal period. Postnatal, it means after delivery. We have a specific organization of the perinatal care in the Republic of Belarus. We have several levels. First, it's district, the lowest level. Second, inter-district. Third, the regional. In every regional hospital, in every region of Republic of Belarus, we have a regional hospital. And fourth, the highest level, it's a Republican. We have only one organization. It's Republican Center of mother and child. Usually, maternity hospitals can be organized in basic divisions or basic branches or chairs. Admission department. The main role is um, to choose the direction of admission of the patient. Maternity ward or delivery department, operative unit, postpartum department, observational or second obstetrical department, department of pathology of pregnancy, department of newborns, intensive care unit, gynecology, laboratory, physiotherapy, and administrative part. Why we have to divide second obstetric or observational department? Because we can uh, we can admit to this department all patients with infectious diseases. It can be respiratory diseases like flu, pneumonia. It can be inflammatory diseases of the urinary system like pyelonephritis. We can mm, we can admit to this hospital patients with elevated body temperature, even if we cannot see the clinical signs of infection. We can admit to this department patients with antenatal or intranatal fetal death, congenital abnormalities, labor at home, because in our country home labor is not legal, absence of any medical records, and antenatal survey. For example, if a patient refuses from such survey. Purulent septic diseases in the postnatal period, neonatal inflammatory diseases, for example, skin, or signs of the intrauterine infection, also we can transfer to this department. Usually, what we have to mention that first of all, in the admission room, all incoming women have to be separated to the physiological or observational department. We have usually two delivery rooms in the maternity ward and two prenatal chambers. Each delivery room and each prenatal chamber can work one by one. During labor, vaginal investigation or vaginal examination should be performed only with the strict indications, usually no more than 5 times. Of course, we have bactericidal radiators and we have a special cleaning of rooms and departments of the maternity hospital. And also we have to use ultraviolet disinfectors and of course antiseptics as well. It was even before the COVID-19 pandemic. Disposal bags, of course. Of course, we try to have a special center of hygiene and epidemiology control. And also we can do the routine preventive disinfection. Sometimes it's possible to do, sometimes it's not very common, but anyway we have such opportunity. What we should do in women's consultation, or it is prenatal counseling. It's outpatient clinic, and usually it is the functions of female consultation is medical checkup for pregnant women and gynecological patients, prevention of complication of pregnancy and labor, prenatal care of fetus, family planning, including contraceptions and abortion, treatment of gynecological diseases, and of course, health education. Specialized medical care. It's a medical care provided by medical specialists in specially designed medical institutions or departments. Of course, in these clinics, it should be used modern medical diagnostic tools and equipment. And branches of specialized medical obstetrical and gynecological care. It's extragenital pathology, miscarriage, congenital and hereditary pathology, infertility, endocrine pathology in gynecology, pediatric and adolescent gynecology, pathology of the cervix, family planning, cancer and precancer diseases, and endoscopic surgery. Of course, we have special centers to prevent some hereditary or genetic pathology, and indications for admission to consultation to such medical genetic center are following: aging mom, 35 years and older, chromosomal disorders or abnormalities in relatives, or maybe previous children with hereditary diseases. It can be consanguinity when mom and dad are relatives. Complications in pregnancy, for example, miscarriage, polyhydramnios, and so on. If we detect some fetal abnormalities using ultrasound diagnostics, or maybe problems which we reveal during biochemical screening. Um, Biochemical screening, it means alpha-fetoprotein, human chorionic gonadotropin, and others. Some biohazards or occupational hazards in parents, and if such patient has primary amenorrhea of unknown origin. And we have a group of reserve for labor. It's specific for our country, not very common to other countries. But anyway, what you should know that before pregnancy we have to perform pregravidal preparation. It's usually folic acid and iodine, dependent on region. And now, how we can understand that a woman is pregnant? It can be symptoms of the first trimester. Trimester, it means from 0 to 12 weeks of gestation. Amenorrhea, morning sickness, breast symptoms like tenderness, appetite changes and sleepiness, gain of the weight, changes on the skin. It can be formation of linea nigra instead of linea alba and darkness of the nipples. Urinary symptoms. Urination become more frequent, and it can be night urination also. Abdominal enlargement, uterine signs. Uterine become more soft, and we can palpate enlargement of the uterus. And vagina. The vaginal wall become more dark, like more violet, and more moisturizing, more wet. The next, fetal movements and fetal signs. Fetal movements for primigravida. It means a woman who has first pregnancy. She can feel the fetal movements only in the second trimester. It will be 20 weeks of pregnancy. A woman who had previous pregnancies and deliveries can feel her fetal movements at 18 weeks of pregnancy. Fetal science, it means when we can see the fetus in the uterus. And examination of pregnant woman should include examination and complaints, medical history, and here passport, life history, reproductive history. It means her menstrual function, age of menarche, duration of the menses and interval between it, sexuality, reproductive function. What does it mean, reproductive function? Number of pregnancies, deliveries, abortions, and maybe miscarriages. Gynecological diseases and genital function, it means secretion. Also, we have to do general objective examination and special obstetrical examination. What does it mean? It means we have to do examination, measurement, palpation, and auscultation, and internal examination per speculum and per vagina. Also, in case of pregnant women, we should include additional methods of diagnosis. So, what we should do during previous prenatal evaluation? The main things are we have to detect pregnancy and we have to estimate the gestational age. The next, we have to define the health status of mother and fetus and perform a plan for the obstetrical care. Of course, typical components of the initial visit you can see on this slide, but what it is necessary to add about special external obstetrical examination, palpation of mammary gland, fundal high and pelvic examination, sacral rhombus or Michaelis rhombus, radiocarpal index of Solovyov index, abdominal circumference, and fetal live presentation position and type of position. Of course, HIV counseling it is necessary to do. Special examination also should include pap smear screening and bacterioscopy, and additional methods of examination should be bacteriological or cultural examination, screening for STDs, sexually transmitted diseases, and sometimes it is necessary to perform a rectovaginal examination. Laboratory test. Usually it's a routine test for every patient who comes firstly to the female consultation. And additional laboratory test. Also you can see such tests on the screen. For pregnant women, of course, we should use examination by the specialist because some extragenital pathology, extragenital diseases can influence the pregnancy, and also pregnancy from its side can influence to the extragenital diseases as well. Why? Because during pregnancy occurs some physiological changes. First of all, cardiovascular, increasing of body volume, of blood volume, sorry. And this increasing of blood volume will be due to increasing of circulated plasma volume more than cell elements. And in pregnancy, we can see the physiological autohemodilution or physiological anemia, a reduction of blood viscosity, but in the third trimester of pregnancy, it will be increased. Increasing of cardiac output, increasing of the heart rate, increasing of venous pressure, a reduction of the peripheral resistance, and also occurs the displacement of the fetal heart, or of the heart's axis. Pulmonary changes. Of course, it can be increasing of the vital capacity and inspiratory capacity, but reserve volume of respiration will decrease, and residual volume also will be decreased. Of course, it's due to the more high condition or higher level of the diaphragm, because pregnant uterus will increase in volume. Of course, musculoskeletal system. Of course, it occurs with weight gain. It can be shift of the center of gravity and increasing of the laxity of ligaments. Of course, it's due to the hormonal influence like estrogen and biological active molecules like relaxin. And additional methods of diagnostic, it's instrumental, ultrasound, Korbut echography, biophysical profile, amnioscopy, and laboratory. Uh, what we should do for perform the antenatal diagnosis? We have to detect the growth and development of the fetus. We have to detect his livability, antenatal care during pregnancy, and reduction, decreasing of perinatal morbidity and mortality. It means reduction of amount of number of diseases and deaths. Uh, Ultrasound examination. It's the easiest and the best method in obstetrics. You can see the modern high class ultrasound apparatus, and we can see uh, pregnancy, number of embryos. We can see the embryo as well, and we can detect the condition of placenta and the amount of amniotic fluid. We can see congenital abnormalities if it is necessary, and any other problems on the uterus. It can be tumors like myoma, it can be ovarian pathology, it can be scar, and any other problems. And here you can see the three-dimensional ultrasound. Even we can see the face of the baby, and we can detect the mood of this baby. Also, it is necessary to do the Doppler study, because we have to understand how the blood flow is in the arteries. CTG. You can see the CTG apparatus in every department, in department of pathology, in labor ward, and also it helps us to understand the fetal well-being in the uterus. We have stress test for detection of fetal well-being. It can be oxytocin, it can be thermal stimulation, it can be nipple stimulation, acoustic stimulation, or exercises of the mom, but it's not very common in our practice. Biophysical profile of the fetus. Also, it takes a lot of time, and that's why it's not very widespread, but you should know about it. And methods for detection of fetal abnormalities. It can be amnioscopy, it can be amniocentesis, which give us a lot of information, but it has some complications and contraindications. Vaginal cytology, it is compulsory, because we have a screening against cervical cancer program, blood test of fetus and newborn, chordocentesis for fetus, and chorionic villus sampling or chorionic biopsy. It's also necessary to do the detection of the congenital abnormalities, and also it has indications and contraindications. Fetoscopy. Now it's very rare method of direct examination, because we have very good ultrasound and biochemical and hormonal investigations. Also, you should check a lot of hormones. We have special centers which perform such biochemical and hormonal investigations. And diagnostics of intrauterine infection, it will be topic of our next lecture. Thank you for attention. I wish you good, first of all, good health, and second, good knowledge of our subject.